Yeah, so this is the first in the series of 3 chest x-rays that I posted today. And this elderly gentleman was seen about 15 days ago and shipped off to the larger hospital where he spent 6 days in there for sepsis, SIRS, pneumonia, and presented again yesterday with right lower rib pain, chest pain area, and weakness. Got in here and room air sat was 86%. So this was his first one, which was back on about 15, 16 days ago. So to start off the read, it's obviously a portable, so it's not the best. A for airways, you can see the trachea coming down here. Kind of difficult seeing carina, so if you were checking for ET2 placement, you'd probably have to do the count the vertebrae, or in this case ribs, just because it's not the best for that as well. And even the ribs are kind of difficult to see. Let me see if I can blow this up a bit. No, not going to let me. So I think that this is probably second rib here. Third, fourth, fifth, sixth. So the carina is probably somewhere right down about here in that area. So B for bones. Bones are all okay. Again, I usually go down the sides here first and see, because that's where you'll usually start picking out unusual angulations. C for cardiac silhouette. And you can see that this silhouette comes here. Remember, it is a portable, so the cardiac silhouette is going to look larger. You can see a piece of the silhouette here. Parts of it are obscured by this fluffy white stuff, which is a silhouette sign, of course. D for diaphragms. You can see the left diaphragm pretty well here. And the right diaphragm, you can see part of it, but then part of it is obscured by all this white fluffy stuff here. E for everything else. You can go out here and you can see lung markings, vascular markings all the way out. This up because I didn't see this part here on my first. Or actually, there's another provider that did him back then, but I just noticed this, and I'm wondering if that might not be a small pneumo. And this does kind of go down kind of deep, so I'll check up on that on the big model and blow it up and check it out. For now, let me erase that. And back to the silhouette and the heart. So we know that the diaphragm being obscured here is the right lower lobe. And when it obscures the heart silhouette here, then it's right middle lobe. So this gentleman had a pneumonia in the right middle and lower lobe here. And that's pretty obvious. All right, so real quick on this one, that I noticed this area here and thought it might have been a pneumo. I went and blew it up on the big screen, and it turned out it's probably just a skin fold. And on the big screen, when you can magnify it, you can see that it's just this area here and doesn't go up here at all. So most likely that's just a skin fold. And back to the other one here. So this was when I received him in the ER yesterday. He came in with pulse ox of 86% on room air. He was weak. His white count was 23,000. Did have a left shift. Newts were elevated. D-dimer was 4,650 on his first admit, and it was 3,500 today or yesterday. And I'm sure that's just from his disease process and not from a PE. Blood pressure was doing fine. His heart rate was elevated at 112. He was afebrile. Respiratory rate was elevated as well, 28. Our lactate machine is down and not going to be fixed till next week, so I was unable to get a lactate, but his anion gap was 13, so I'm assuming his lactate was probably slightly elevated, not hugely so. VBGs were pretty much unremarkable. So first we're going to talk about what the chest x-rays showed, and of course this is the PA here. I had a PA lateral done. He was able to stand up. And so we're going to start by, this is kind of a poor picture. Sorry about that. I cut off the tops there. What the heck? Although it's just on here, it's not on my monitor. I can see the tops on my computer monitor, so I'm not sure what's going on. Well, anyway, the tops are fine. We'll just have to take my word for it. So A for airway, you can see the trachea coming down here. You can see where it bifurcates. You can see how much better quality this film is versus the portable chest. So here's carina. Then B for bones. Bones are okay. C for cardiac silhouette. Here on the left side, you can see the heart there. And the right side is pretty much, can't see it much. You can see it's still has a lot of the consolidation that was apparent on his first chest x-ray a couple weeks ago. Although it is looking better in this particular area, but in any case, so on to D for diaphragms. You can see the left diaphragm here. And gastric bubble, bowel. Then the right diaphragm you can't really see, but you do see that it's white all in here, as well as right here. And E for everything else. You're going to look at the lung fields now. And sorry again about cutting off that top. So we can see the vascular markings do go all the way out on both sides. But you can see a streakiness in here, as well as some streaking going on over here as well, plus just an outright consolidation blocking and covering the right side of the heart there. So he obviously still has pneumonia going on, and since this is a silhouette sign, excuse me, over the heart, you know that's right middle lobe. And then he has a pulmonary effusion down here that's obscuring his diaphragm. And me being curious, I put an ultrasound on him, which I'll pull up here in a minute, and we'll go over that as well. But of course I was able to see fluid on the ultrasound. And let's pop up the lateral here real quick. So here's his lateral film, and you can see, and I forgot to mention on the PA, you can see his aorta so plainly, and there's a term for that. I don't remember what it is. Achesia, or anyway, and this is a normal variant, an old calcified aorta. Let me just delete that. And but one thing you want to be aware of is this silhouette sign here. And as you go down the spine and the vertebrae here, it should start off white, which it does, whiter, and then progressively get black all the way down here. And you can see this doesn't. But that sign's called more to black sign. I just call it silhouette sign, much easier. But right in here you can see this white right here as a silhouette sign. So you know that we saw it on the right-hand side on the PA, so you know this is right lung, right lower lung, and even more specific, you know, the posterior portion of the right lower lung, as well as the diaphragm here is obscured too by the pleural effusion. Get rid of all this red here. So this here is the left diaphragm, and you don't see the right, which should be right above it, kind of going like this, and you don't really see that, and that's why, is because the pleural effusion and consolidations are obscuring it. But that white is just really interesting. Hey, also, this is the ultrasound of the right upper quadrant, and you can see liver, spine, diaphragm. Diaphragm looks pretty rough from the consolidations. You can also see some fluid up in the upper section there. So let me see if this will let me mark on it. I'll stop it here. So this is liver. And this down here is spine. And you can see diaphragm up here. This is diaphragm. You can see how rough this looks in here, and this is from the consolidation that we saw in chest x-ray. This section here is fluid, and I had to scan this patient sitting up because he couldn't lay flat, so it's like a semi-Fowler's position. So it's not the best position, and it was just a difficult ultrasound, and plus this is with my butterfly, which is pretty good, but not as good as the nice expensive Terrasons or Sonocytes. And I could have done a little bit of a better job there, but you can see how when it swings, you can see that black section, and that's the pleural effusion there. You can see how rough all this looks in here. Let me restart this. See how rough all that looks in there? That is consolidation. So I'm sure this will probably be an exudative pleural effusion caused from his pneumonia. And this patient, let me start. There we go. This patient I shipped off to a bigger hospital with an ICU. I'm in a small rural place. I gave him a dose of Zosyn, 4.5 grams, and shipped him up there where he's still in ICU but doing better. He met the SIRS criteria, and so anyway, I hope this was interesting to you, and we'll see you next time.